America is on the brink of an obesity crisis by 2030. Are we eating ourselves to death? This alarming situation isn't just about carrying extra weight, it's about the serious health risks and economic burdens that come with it. Obesity rates have been climbing rapidly, and if this trend continues, the consequences will be devastating. More people will suffer from chronic diseases, healthcare costs will skyrocket, and the quality of life for millions of Americans will decline. The statistics are shocking. Over 40% of adults in the United States are already classified as obese. This number is expected to rise sharply in the next decade. Unlike other health issues, obesity is largely preventable, which makes this crisis even more frustrating. The combination of poor diet, sedentary lifestyle, and socioeconomic factors is driving this epidemic. Fast food, sugary drinks, and processed foods are readily available and heavily marketed, making healthy choices harder for many people. The purpose of this video is to explore the causes, consequences, and potential solutions to the obesity crisis. We will look at how our eating habits and lifestyle choices contribute to this problem. We will discuss the severe health impacts and economic costs associated with obesity. We will explore what can be done on both a personal and societal level to reverse this trend. This is a critical issue that affects us all, and it's time to take a stand against obesity. Obesity rates in America are at an all-time high. Over 40% of adults and nearly 20% of children are classified as obese. This isn't just a number, it represents millions of people struggling with their health every day. Compared to other countries, the United States has one of the highest obesity rates in the world. This shows that the problem is not just personal, but also cultural and systemic. The increase in obesity rates over the past few decades is alarming. In the 1970s, about 15% of adults were obese. Now, that number has nearly tripled. This rapid rise points to significant changes in our lifestyle and environment. Fast food has become a staple in many people's diets, and physical activity has decreased with the rise of technology and sedentary jobs. These changes have created a perfect storm for an obesity epidemic. Children are also affected, with obesity rates tripling since the 1970s. This trend sets up a future generation for serious health problems. Kids who are obese are more likely to become obese adults, continuing the cycle. They face higher risks for diabetes, heart disease, and other chronic conditions at a much younger age. This not only impacts their health, but also their ability to enjoy a normal, active childhood. Addressing the current state of obesity is crucial for the future of our nation. The high rates of obesity strain our healthcare system and reduce the quality of life for millions. It's clear that we need to take immediate action to stop and reverse this trend. The obesity crisis in America has several causes. Diet and nutrition play a major role. Fast food has become a huge part of our culture, offering quick and cheap meals loaded with calories, sugar, and unhealthy fats. These foods are designed to taste good and be addictive, making it hard for people to choose healthier options. Sugary drinks like sodas and energy drinks add to the problem by providing a large number of empty calories with no nutritional value. Lifestyle factors also contribute to the obesity epidemic. Many people lead sedentary lives, spending hours sitting at desks, watching TV, or using computers and smartphones. Physical activity has decreased dramatically, especially among children, who often prefer playing video games to playing outside. This lack of exercise means that people are not burning off the calories they consume, leading to weight gain. Socioeconomic factors make it even harder to combat obesity. People living in poverty often have limited access to healthy foods. Fresh fruits and vegetables can be expensive and hard to find in certain areas, known as food deserts. Additionally, many low-income families lack nutritional education, making it difficult to make healthier choices. The constant stress of financial insecurity can also lead to emotional eating, where people turn to food for comfort. The combination of a poor diet, a lack of exercise, and socioeconomic challenges creates a perfect storm for obesity. To address this crisis, we need to understand and tackle all these factors. Changes in public policy, community support, and individual choices are all necessary to reverse the trend and create a healthier future for everyone. Obesity has serious health consequences that can affect nearly every part of the body. One of the most significant risks is the increased chance of developing chronic diseases. Obese individuals are at a higher risk of heart disease, which is the leading cause of death in the United States. High blood pressure, high cholesterol, and blocked arteries are all more common in obese people, leading to heart attacks and strokes. Diabetes is another major health issue linked to obesity. Type 2, diabetes in particular, is strongly associated with being overweight. When the body has excess fat, it becomes resistant to insulin, causing blood sugar levels to rise. This can lead to serious complications like kidney disease, nerve damage, and vision problems. Managing diabetes requires constant attention to diet and medication, making life more difficult for those affected. Obesity also puts a significant strain on the joints, leading to conditions like osteoarthritis. Carrying extra weight puts more pressure on the knees, hips, and lower back, causing pain and reducing mobility. This makes physical activity even harder, creating a vicious cycle where lack of exercise leads to more weight gain and further health problems. Mental health is another area impacted by obesity. Many people who are obese face stigma and discrimination, which can lead to low self-esteem, depression, and anxiety. The constant battle with weight can also cause emotional stress, making it difficult to maintain a positive outlook on life. This mental strain can further complicate efforts to lose weight and improve health. The healthcare system is heavily burdened by the consequences of obesity. Treating obesity-related conditions costs billions of dollars each year, money that could be used for other health initiatives. Hospitals and clinics see more patients with preventable diseases, leading to longer wait times and strained resources. Reducing obesity rates would not only improve individual health, but also ease the pressure on healthcare providers and the economy. The obesity crisis has major economic impacts. The healthcare costs associated with treating obesity-related conditions are staggering. Each year, billions of dollars are spent on medical care for heart disease, diabetes, and other illnesses linked to obesity. These costs put a huge strain on the healthcare system and increase insurance premiums for everyone. Employers also face higher expenses due to obesity-related health issues, which can lead to increased absenteeism and lower productivity among workers. Beyond healthcare costs, obesity affects the economy through lost productivity. People who are obese are more likely to miss work due to health problems. When employees are frequently absent or less productive, it affects the overall efficiency of businesses. This loss of productivity costs the economy billions of dollars every year, making it harder for companies to thrive and compete in the global market. Socially, obesity can lead to significant stigma and discrimination. Obese individuals often face negative stereotypes and biases, which can affect their mental health and self-esteem. This discrimination can occur in various settings, including workplaces, schools, and even within families. The social stigma associated with obesity can lead to feelings of isolation and depression, making it even harder for individuals to seek help and make healthy changes. Obesity also affects quality of life. People who are obese may find it difficult to participate in everyday activities, such as playing with their children, walking upstairs, or enjoying hobbies. This can lead to a sense of frustration and a decreased overall sense of well-being. When a large portion of the population is affected in this way, it impacts the social fabric of communities and reduces the overall happiness and productivity of society. Resolving the social and financial effects of obesity calls for a comprehensive strategy. Policies that promote healthier food options, encourage physical activity, and reduce stigma are essential. We can build a better, more productive society if we deal with these problems directly. There needs to be a coordinated effort across industries to combat the obesity epidemic. Government and policy changes can play a significant role. Implementing regulations that limit the advertising of unhealthy foods, especially to children, can reduce the consumption of high-calorie, low-nutrient products. Subsidizing healthier food options and ensuring they are available in all communities, including food deserts, can make nutritious choices more accessible and affordable for everyone. Schools and community programs are crucial in promoting healthy habits. Schools can provide healthier meals and incorporate more physical activity into the daily routine. Educating children about nutrition and the benefits of exercise from a young age can set the foundation for a healthier lifestyle. Community programs can offer exercise classes, cooking workshops, and support groups to help individuals make lasting changes. Personal responsibility is also key in combating obesity. People need to be informed and motivated to make healthier choices. Simple changes, like reducing portion sizes, cutting back on sugary drinks, and incorporating more fruits and vegetables into meals, can make a big difference. Regular physical activity, whether it's walking, biking, or participating in sports, is essential for maintaining a healthy weight. Healthcare providers have a role in supporting patients. Doctors and nurses can offer guidance on weight management, provide resources for nutrition and exercise, and help set realistic goals. Regular checkups and screenings can catch obesity-related health issues early, making them easier to manage. Psychological support, such as counseling or therapy, can also help individuals address emotional eating and build a healthier relationship with food. Public awareness campaigns can shift societal attitudes toward obesity. Promoting positive body image while encouraging healthy behaviors can reduce stigma and empower people to take control of their health. Collaboration between government, communities, healthcare providers, and individuals is essential to create a supportive environment that fosters healthy living. Taking these steps can help turn the tide on the obesity crisis and pave the way for a healthier future. The obesity crisis in America is a pressing issue that demands immediate attention. We've explored the alarming rise in obesity rates, the significant health consequences, and the economic and social impacts. It's clear that the path we're on leads to serious problems for individuals and society as a whole. However, there is hope. By understanding the causes and implementing effective solutions, we can turn this trend around. Each of us has a role to play in combating obesity. Making healthier food choices, increasing physical activity, and supporting policies that promote well-being are steps we can all take. Communities can come together to create environments that encourage healthy living, while schools and workplaces can implement programs that support better health for everyone. We need your voice in this fight against obesity. Share your thoughts and experiences in the comments below. How has obesity affected you or your loved ones? What changes would you like to see in your community? Your input can help shape the conversation and drive action. It's time to take a stand and work together for a healthier future. Encourage your friends and family to make healthier choices and support local and national efforts to address this crisis. Let's make a commitment to our health and the health of our nation. Together, we can overcome the obesity crisis and build a brighter, healthier future.